I've been asked to speak a little bit about vulnerability, and I think there's lots of ways to understand and think about vulnerability, and it's one of those terms that kind of gets tossed around. So I thought I'd just take a minute. I hope I know how to work this. I thought I'd take a minute to just think or talk a little bit about how we understand vulnerability, and I think there's a typical way that we understand it, which is often about characteristics or experiences. So things that happen to individual people that make them vulnerable. And I always like to use stories as examples of what I'm talking about. So a very, very condensed version of Mike's story. When Mike was a baby, toddler, preschooler, he lived in a very violent home. And he was made vulnerable because he was a child and because he was hurt. And so that's a very sort of typical understanding of vulnerability. I think another dimension to vulnerability that guides a lot of my work is what I think of as structural vulnerabilities. And so these are the ways in which people often interact with public systems that are dictated and informed by policies, social, public, and economic policies, which then dictate service delivery, which then impacts people in their daily lives. And so vulnerability for me happens when forces outside of our control limit our opportunities. And opportunity is a very intentional word. It is distinct from choices. That's a debate and discussion for another day, but it's important for me to think about it in that way. In other words, vulnerability is the ways in which people are made vulnerable through their interaction with systems. So if we just quickly return to Mike's story, when it became clear that Mike was in trouble, there was an intervention, and his parents were arrested, and Mike went into the foster care system. And foster care is a good intervention for a lot of people. It wasn't a good intervention for Mike, and he was bounced around a lot and moved from family to family and never found his place of fit. And so as he got older, he got into trouble, and he got into trouble at school, and when he got into trouble at school, the response was punishment. And when he got into trouble with the law, of course, the response was punishment. And so in his mind, each of those times when he was acting out, he was actually reaching out, and the response actually made life more difficult for him. So that sort of cycling through systems actually had a very deleterious and damaging effect to Mike. And when I met him when he was 22, he was living in one of our homeless shelters. So what do we do about it? This is sort of how I think about vulnerable populations research within the O'Brien Institute and within my own program of research. I think systems level research is the key. And so our questions are sometimes looking at individual vulnerabilities, whether it's homelessness or domestic violence, poverty, intergenerational trauma, all the things that affect us as individuals. Those are sometimes a way in to understand structural vulnerabilities. And so if when we meet people experiencing homelessness, we collect their stories, and we think about relationships and correlations, and all that stuff is really good to get published. But most importantly for me, those experiences help me understand where our systems are working well and where they're not working well. And I think more importantly then is the result, which I always hope is collective action. And so when I do research projects, and lots of the projects that we've done at the O'Brien Institute have really been community engaged and rooted in collaboration. And so in addition to the traditional things like scholarly publications, we try and create reports with recommendations in collaboration with community partners and agencies who then have some evidence and some fuel and some fire to move towards recommendations. And we do see, we have seen some good examples of social change, changes to policy, changes to service delivery. So to wrap things all up, why is this important? Why is vulnerability, why are vulnerable populations social vulnerabilities, however you want to think about it? Why is it important to the O'Brien Institute? Why is it important to public health broadly speaking? In my mind, examining inequities at a systems level helps us understand the bigger picture issues, the structural issues that are often outside of our control but have a direct impact on vulnerability, health, and well-being. And that's it for me. Thank you.